Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
I came in today because I've been following up on this lung mass they found on my scans a while back. I believe it first showed up around the mid-90s, but this recent growth has really got me worried. I've been trying to keep my mind off it, but it's not easy when you're thinking it might be something serious.
I understand your concerns, especially with the recent changes observed in the imaging. Let's go through everything systematically. When exactly did you first become aware of this mass?
Well, from what I remember, they first noticed something on an X-ray back in 95 or 96, but it was really small back then. It's been looked at off and on since. This July's scan showed it got a bit bigger, which hasn't happened before, so that's why I'm here now. Plus, this unintentional weight loss hasn't helped. I've dropped about 15 pounds without trying over the past few months.
That weight change is significant, and it's good that you've brought it up. Have you noticed any other symptoms? Anything like a persistent cough, changes in your breathing, or unusual pains?
No, nothing like that. Just the weight, really. No coughs or real breathing issues, which I guess is a bit odd considering where the mass is.
It's good to hear that there are no severe respiratory symptoms. That helps us in assessing the situation. How about your recent experience with anticoagulation? I see that you've had to switch medications temporarily.
Oh, the blood thinners? Yes, I've been on Coumadin for a long while because of my irregular heartbeat. The doctor suggested switching to Lovenox injections before the biopsy to manage the clotting risk. It's a bit more hassle, but if it's safer for the biopsy, I'm okay with it.
It's a prudent step for the procedure. We also need to address your blood pressure variability. How has that been affecting you day to day?
It's all over the place, honestly. High in the morning, and then after taking my pills, it drops. By night, it's so low I sometimes feel dizzy. We talked about adding back hydrochlorothiazide. I used to take it a few years ago.
Managing that fluctuation will be important, especially to keep you stable for your upcoming tests and procedures. Speaking of which, we have your MRI and PET scans scheduled soon to get a clearer picture of the mass and check for any spread. The biopsy next month will give us definitive answers about the nature of the mass. It's vital we proceed with these to understand what we're dealing with.
Yes, I'm geared up for those. I hope they don't find anything bad, but I also just want to know what it is. Also, my daughter, she's very involved in my care. I want her to be kept in the loop with everything that's going on.
Absolutely. Keeping your daughter informed is part of our plan. I will personally give her a call after each of your major appointments to update her on your status and our findings. Now, let's review the details of your current health status to make sure we have a complete understanding.
Sure, doctor. What do you need from me?
I'm going to confirm some recent clinical observations and test results, just to have a clear current picture. Your blood pressure this morning was quite high at 108-110 mmHg, but has since dropped post-medication. Your heart rate has been stable and within a normal range during the day. Respiratory rate is also normal, and your body temperature is within the normal range.
Yes, that sounds about right. I've been monitoring at home too, and those figures align with what I've seen.
Good. That consistency is helpful. Your recent lab tests show normal liver and kidney function, except for a slightly elevated creatinine. We'll keep an eye on that. Your CBC is within normal limits, and though your coagulation profile will change due to the Lovenox, it was stable on Coumadin. Your ECG shows a normal rhythm with occasional premature beats, which fits with your history of atrial fibrillation.
Okay, sounds like a lot, but I'm glad we're checking everything.
Yes, we're being thorough. For now, continue with the medication adjustments we discussed. We'll proceed with the imaging and biopsy as planned, and I'll keep you and your daughter informed every step of the way. We'll have a follow-up appointment after your tests to discuss the results and decide on further actions based on those findings.
Thank you, doctor. I appreciate you taking the time to explain everything.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been having some trouble with my feet again, especially with calluses and corns. They've been really painful lately, and the treatments I've tried so far haven't helped much. I've been using over-the-counter products, but they don't seem to work well. I remember using Tinactin before, and it seemed to help better than what I'm currently using.
I see you've had persistent issues with your feet. Can you tell me more about what treatments you've tried, apart from Tinactin?
Well, I've tried various creams and even some padding for my shoes. Nothing seems to prevent them from coming back. It's frustrating because it makes it difficult to stay active, which is important for my overall health and recovery.
Understood. It's good to keep active, especially given your history. Speaking of which, how are you managing your other health concerns lately, particularly your blood pressure and the substance abuse recovery?
My blood pressure has been pretty stable, I think, thanks to the meds and trying to stay calm and stress-free. As for the recovery, it's a daily challenge, but I'm committed. Living in the recovery home has been a great support. They really help me focus on staying clean, and I'm planning to move into a VA-sponsored apartment soon, which I hope will be a good next step.
That sounds like a positive move forward. Now, about your sexual health, you mentioned wanting to continue with the enhancement medication. How has that been going for you?
It's been okay, but I feel it's something that I still need. It helps me maintain normalcy and confidence in that part of my life. It's important for me, you know?
Absolutely. Maintaining your quality of life in all aspects is important. How about your efforts to quit smoking? You mentioned using cessation gum.
Quitting smoking has been tough. I use the gum, which helps a bit, but it's still a struggle every day. I'm not giving up, though. I know it's crucial, especially with my health history.
It's great that you're not giving up. Every step you take is important. Have you noticed any changes in your health since you started it?
I think my breathing's been a bit better, and I don't feel as short of breath. Maybe it's helping my lungs some, or maybe it's just because I'm smoking less.
Improvement in breathing is a good sign. We'll keep monitoring that. Now let's discuss your preventive care. I understand you've had your flu vaccine and are scheduled for a colonoscopy soon.
Yes, I had the flu shot, and I'm getting the colonoscopy because I found out the one during my hernia repair wasn't the right kind. I want to make sure everything's okay there.
That's a wise decision. Regular checkups and these preventive measures are vital, especially considering your family history of high blood pressure. It helps us catch anything significant early.
I agree. I just want to keep on top of everything, make sure I'm doing all I can to stay healthy.
Okay, let's summarize and plan the next steps based on our discussion today. For your foot issues, I'll refer you to a podiatrist who specializes in diabetic foot care. Although you don't have diabetes, their expertise in foot problems will be beneficial. We'll also revisit the use of tinactin as part of your treatment plan. Regarding your blood pressure, your current regimen of lisinopril and hydrochlorothiazide will continue since it's maintaining your pressure well. I'm glad to hear you're taking your recovery seriously, and the planned move should provide a stable environment to support this. For your sexual health, we will continue the enhancement medication as it contributes positively to your quality of life. As for smoking cessation, let's explore additional support, possibly including patches or prescriptions if you're open to that, to help you quit smoking more effectively. We'll do a follow-up on your liver function due to the slight elevation in your enzymes, and keep an eye on your lipid panel and glucose levels, which are currently within acceptable ranges. Your next scheduled follow-up is in 6 months, but we'll have you come in sooner for the blood tests and any specific treatments needed before then. Does that sound good?
Yes, doctor. That sounds great. I appreciate your help and the clear plan. It makes me feel more in control of my health.
You're welcome. It's my job to help you stay informed and in control. I'll see you soon for the follow-up, and we'll make sure everything is on track.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Okay, for the handover, we have Mr. Thompson in room 204. He was admitted last night due to congestive heart failure and has a long-standing history of type 2 diabetes.
What's his current medication regimen?
He's on metformin for the diabetes, Lasix for fluid retention, and lisinopril for blood pressure. His last blood sugar was high at 190 milligrams per dealer. Note that he's allergic to penicillin.
Does he have any specific dietary restrictions?
Yes, he's on a strict low-sodium diet and requires close monitoring of his fluid intake due to his heart condition.
Any mobility issues or other assistance he might need?
He's using a walker and generally needs assistance with daily activities. His mobility is limited, so we need to help him move around to prevent any falls. Keep an eye on his fluid output too, and document everything diligently.
Got it. I'll also check in with him about his pain levels and overall comfort.
Perfect. Let's ensure the night shift gets this information too. Thanks for the thorough update.
Now look at question 26.
Good morning, everyone. I'm here to introduce our new cardiac rehabilitation program, designed specifically to support patients in their recovery journey post-heart surgery. This program includes several key components: monitored physical activity, nutrition counseling tailored to heart health, and sessions aimed at managing stress and emotional well-being. Each patient entering the program will be evaluated to create a personalized plan that caters to their specific health needs and recovery goals. Our ultimate goal is to minimize the risk of future cardiac incidents through sustainable lifestyle changes. We've brought together a skilled team of cardiologists, nurses, dietitians, and physical therapists to ensure comprehensive care. I encourage all of you to refer patients who can benefit from this program. It's a great opportunity for them to enhance their recovery and improve their overall quality of life.
Now look at question 27.
It's crucial for you to know when to seek immediate medical attention, especially given your recent symptoms. If you experience severe chest pain, acute shortness of breath, or if you faint, call emergency services right away.
What should I do if the symptoms are less severe, like mild headaches or dizziness?
In those cases, it's important to rest and stay hydrated. If these symptoms persist beyond a few days or suddenly worsen, you should come in for a checkup. It's better to be cautious with these matters.
Understood. And if I have any concerns about my medications, or if I'm experiencing side effects?
Always reach out to us. You can contact our office directly or use the nursing hotline if it's after hours. Managing your medication effectively is crucial for your health.
Now look at question 28.
Today, we're excited to introduce a new initiative aimed at supporting our cancer patients more effectively. We are setting up facilitated group sessions where patients can come together to discuss their experiences and challenges. These sessions will be led by a facilitator who will guide the discussion on topics like managing side effects, nutritional advice tailored to cancer treatment, and emotional support strategies. This setup will provide a platform for patients to share and learn from each other. We'll meet weekly, and each session will be adapted to the group's needs. We're also encouraging family involvement in some sessions to help them better support their loved ones. Your feedback on these sessions will be invaluable as we aim to tailor our care to better meet your needs and enhance the hospital's support services.
Now look at question 29.
It's great to see you for your routine checkup today. How have you been feeling overall?
I'm doing okay, just feeling more tired than usual lately.
I'll make a note of that. Fatigue can be a sign of various things, so we should keep an eye on it. How's your medication regimen? Staying on track with that?
Yes, taking everything as prescribed, no issues there.
Good to hear. Remember, it's important to keep up with your annual screenings and blood tests. These help us catch any issues early. You've got a cholesterol check coming up, right?
Yes, I'll make sure to schedule that. I appreciate you reminding me.
Now look at question 30.
I want to emphasize the importance of the upcoming medical equipment training for all clinical staff. As we integrate new technologies into our care protocols, it's essential that everyone is proficient in using these tools. The training sessions will cover everything from the basic operation of new electrocardiogram machines to the advanced features of our updated patient monitoring systems. Attendance is mandatory for all staff involved in patient care. We have multiple sessions scheduled over the next month to fit different schedules. This training is not just about handling the equipment, it's about ensuring our patients receive the safest and most effective care possible. Please ensure you register for a session as soon as they are available.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Today, we will be discussing a complex and often under-recognized topic in gastroenterology, focusing on a recent comprehensive review of gastroesophageal reflux disease, commonly referred to as GERD. This discussion will incorporate insights from the latest guidelines by the American College of Gastroenterology, which offers an in-depth approach to managing difficult cases of GERD. For this talk, we will also delve into a case study that reflects these complexities. To begin, GERD is a condition characterized by the reflux of stomach contents back into the esophagus, which leads to symptoms such as heartburn, regurgitation, and, in some cases, complications like esophagitis or Barrett's esophagus. The management of GERD has evolved significantly, with the recent guidelines emphasizing a more tailored approach based on patient symptoms and response to initial treatment. One key recommendation that stands out in these guidelines, and is particularly relevant to our discussion, is the initial management strategy for patients presenting with typical GERD symptoms, but without alarm features like dysphagia, bleeding, or weight loss. The guidelines suggest starting these patients on an 8-week course of proton pump inhibitors, PPIs. This is crucial because the response to this treatment can significantly guide further diagnostic and management strategies. Now, let's consider a case study to see how these guidelines apply in practice. Imagine a patient, Mr. Smith, a 45-year-old male who presents with a year-long history of heartburn and regurgitation, worsening over the last 3 months. He reports no alarm symptoms, but mentions that his quality of life is increasingly affected. According to the new guidelines, Mr. Smith would be an ideal candidate for an 8-week trial of PPI therapy. This approach serves 2 purposes. It helps in confirming the diagnosis of GERD based on symptom resolution, and helps in assessing the need for further investigation if symptoms persist or recur after the cessation of therapy. If we follow the guidelines, after the 8-week trial, there are several possible outcomes for a patient like Mr. Smith. First, if he shows no improvement, this could indicate a need for further evaluation, such as an endoscopy, to rule out other causes or to confirm the presence of complications like esophagitis. Alternatively, if Mr. Smith's symptoms resolve during the treatment but recur afterwards, this would necessitate a reassessment. According to the guidelines, such a scenario would prompt consideration of either optimizing PPI therapy, exploring other treatments like H2 receptor antagonists, or even considering diagnostic measures like esophageal pH monitoring or impedance testing. Moreover, the guidelines recommend that for patients who respond to the initial PPI therapy and do not experience recurrence, a step-down approach can be attempted. This involves reducing the medication dose or frequency, which can help in minimizing long-term medication use while managing symptoms effectively. Importantly, these recommendations also emphasize the necessity of lifestyle modifications alongside pharmacological treatments. Dietary changes, weight management, and modifications in eating habits are all integral parts of managing GERD effectively. In Mr. Smith's case, discussing these aspects would be essential, as they can significantly impact the long-term management of his symptoms. Another critical point raised in the guidelines is the management of patients with persistent symptoms despite treatment. For such cases, a detailed assessment, including endoscopic evaluations and reflux monitoring, is recommended to differentiate between true refractory GERD and other potential gastrointestinal disorders, such as functional heartburn or eosinophilic esophagitis. The new guidelines provide a comprehensive framework for the management of GERD, focusing on a patient-centered approach that tailors treatment based on individual response and symptomatology. This approach not only helps in effective symptom management, but also aids in the appropriate allocation of healthcare resources by preventing unnecessary investigations and treatments. For practitioners, staying updated with these guidelines is crucial in providing optimal care to patients suffering from this common but challenging condition.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, we delve into the complexities of COVID-19 vaccine durability and its implications on public health policy, with a special focus on the findings from the Siren study conducted in the UK. This study, which has garnered significant attention, provides critical insights into the duration of vaccine-induced immunity against COVID-19 infection and reinfection, particularly in a cohort of healthcare workers. To frame our discussion, let's consider a case study that illustrates the real-world impact of these findings. In June 2020, a healthcare worker named Sarah, who is part of our ongoing cohort study, received her first dose of a COVID-19 vaccine. Sarah, aged 42 and previously uninfected, represents an important demographic as healthcare workers are at heightened risk of exposure to SARS-CoV-2. Following her vaccination, she participated in our routine monitoring through monthly blood tests and biweekly nasal swabs to detect both symptomatic and asymptomatic infections. The initial results from our study, which included data from over 35,000 participants like Sarah, revealed a vaccine effectiveness of 85% after the first dose among those who had not previously contracted the virus. This high level of effectiveness underscores the critical role of vaccination in controlling the spread of the disease, especially in high-risk settings. However, the durability of this protection is where our findings become particularly compelling. By analyzing the data over several months, we observed a decline in vaccine effectiveness to about 51% between 9997 and 205 days post-second dose. This waning immunity highlights the potential need for booster vaccinations to maintain adequate protection, especially among frontline healthcare workers. In Sarah's case, she did contract COVID-19 approximately 7 months after her second vaccine dose, during the prevalence of the Delta variant. Fortunately, her symptoms were mild and she recovered quickly, which aligns with our findings that vaccination significantly reduces the severity of the disease even when the protective effect has diminished. This brings us to the policy implications of our study. Our data suggests that booster doses are likely necessary to sustain high levels of immunity, particularly in the face of emerging variants like Delta and Omicron. The decision on the timing and frequency of these boosters must be informed by ongoing surveillance and research, such as the Siren study, to optimize vaccine strategies and protect vulnerable populations. Furthermore, our analysis extends beyond just the effectiveness of the vaccines. We are also investigating the predictors of reinfection and immune response durability by examining neutralizing antibodies against various strains of the virus. This research will help us understand why certain individuals, like Sarah, might experience reinfection despite being vaccinated, and how we can better tailor our vaccination programs to these nuances. While our study confirms the effectiveness of COVID-19 vaccines in preventing infection and reducing disease severity, it also highlights the need for ongoing research to address the challenges posed by waning immunity and variant evolution. The insights gained from tracking healthcare workers' immune responses are invaluable in shaping public health responses and ensuring the continued efficacy of our vaccination programs.